1. Protects eye health. Vitamin A is a critical part of the rhodopsin molecule, which is activated when light shines on the retina, and it sends a signal to the brain, which results in vision. Beta-carotene, the form of vitamin A found in plants, plays a role in preventing macular degeneration, the leading cause of age-related blindness. In a study sponsored by the National Eye Institute as an age-related eye disease study, people at high risk for the disease who took a daily multiple vitamin that included vitamin A, vitamin C, vitamin E, zinc and copper had a 25% reduced risk of advanced macular degeneration during a 6-year period. Studies also showed that vitamin A eye drops are effective for the treatment of dry eyes. One study found that over-the-counter lubricating eye drops containing vitamin A were as effective for the treatment of dry eye syndrome as more expensive prescription eye drops formulated for dry eye relief. Another study was done in early 2011 by researchers at Columbia University Medical Center in New York. They found that a synthetic, altered form of vitamin A might be able to slow the progression of Stargardt's disease, an inherited eye disease that causes to provides immune support, boosts immunity. Icon Immune system illustration. Several immune system functions are dependent on sufficient vitamin A, which is why it is known as an important immune-boosting vitamin. Genes involved in immune responses are regulated by vitamin A, which means it is essential for fighting serious conditions like cancer and autoimmune diseases, but also illnesses like the flu or common colds. Beta-carotene is also a powerful antioxidant that can help boost the immune system and prevent a variety of chronic illnesses. Vitamin A can especially help the immunity of children. A study done in London found that vitamin A supplements reduce child mortality by 24% in low and middle-income countries. The study also found that vitamin A deficiency in children increased their vulnerability to infections like diarrhea and measles. Another study conducted by the Colombian Health-Related Social Security System gave 100,000 children vitamin A supplements who typically weren't taking any. They found that there was an estimated savings in medical costs of $340,306,917 due to the number of events involving diarrhea, 4,268, and malaria, 76, and hospitalization that were reduced due to the supplementation. This study concluded that it would be cost-effective to use vitamin A supplements for the treatment of these medical issues in children. 3. Fights inflammation. Flame icon. Vitamin A has antioxidant properties that neutralize free radicals in the body that cause tissue and cellular damage. Vitamin A can prevent the cells from becoming overactive. When the immune system overreacts to food proteins, this is what creates food allergies and eventually inflammation. Vitamin A intake can help to lower the risk of certain types of food allergies because it helps to prevent this dangerous overreaction. Reduced levels of inflammation are also correlated with the lower risk for neurodegenerative diseases like Alzheimer's disease and Parkinson's disease. 4. Supports skin health and cell growth. Hair follicle icon. Vitamin A is necessary for wound healing and skin regrowth. It is needed to support all of the epithelial, skin, cells both internally and externally, and is a powerful aid in fighting skin cancer. Vitamin is needed to form glycoproteins, a combination of sugar and protein, which help the cells bind together forming soft tissues. A deficiency of vitamin A can lead to a poor complexion, as indicated by studies that prove that vitamin A can fight acne and improve overall skin health. Vitamin A keeps the lines and wrinkles in your skin away by producing more collagen, which is responsible for keeping the skin looking young. Vitamin A can also contribute to healthy hair. 5. Helps prevent cancer. Fights cancer. Black ribbon. According to a study conducted at the University of York, vitamin A intake could help treat several forms of cancer thanks to the vitamin's ability to control malignant cells in the body. It is currently understood that retinoic acid plays important roles in cell development and differentiation as well as cancer treatment. lung, prostate, breast, ovarian, bladder, oral, and skin cancers have been demonstrated to be suppressed by retinoic acid. Another study collected numerous references demonstrating the findings of retinoic acid in melanoma, hepatoma, lung cancer, breast cancer, and prostate cancer. Researchers found new evidence indicating that the molecular mechanisms in retinoic acid may control cancer cells' fates. Since high doses of retinoic acid may lead to cytotoxicity, meaning it can be toxic to cells, so it is probably best utilized as a potential supplement in one's daily diet to prevent or suppress cancer progression.